Hi dear students, welcome to the class of Kidscovery. Myself Dr. Parv. We are discussing the important topic of pediatrics, pediatric orthopedics and rheumatology, and the syndrome which I am going to discuss today is not a long case in UG, very important Viva question, very important theory question, very important competitive exam question, but of course not a long case itself, right? So Marfan syndrome is something in which you'll watch tall people, like tall males, tall females, like that. Remember, it's a connective tissue disorder and there is defective fibrillin 1 protein. So Marfan, so you can remember from this F that this is the fibrillin 1 protein which is defective. Okay, so fibrillin 1 protein is something which is defective in Marfan syndrome. Now what is the gene mutation? So just remember fibrillin is like this. So F, B and N. Okay, F, B and N. So FBN1 gene on chromosome 15 which is present, it is actually, so this is 15, okay, so which is actually defective. So that's why you will have what? You are going to have the Marfan's syndrome. So Marfan syndrome, please remember Marfan. So Marfan syndrome is a dominant disease. It's an autosomal dominant disease. So from dominant you can remember M for Marfan's, okay. So Marfan's is actually a dominant disease. So what happens, like because of the defective fibrillin 1 gene, there is abnormal elastin deposition in extracellular matrix that is going to have a weak connective tissue like aorta, like lens, like skeletal muscles. They are going to be weak because elastin is getting deposited in the extracellular matrix and they are not going to support the aorta, the lens, the skeletal muscles, and that's why the lens is not going to be in place and there will be dislocation of the lens which will be seen. Marfan syndrome is very well associated with abdominal, or I should say aortic aneurysms. Okay, why? Because the elastin fiber a lot of elastin fibers is going to get deposited outside, so that's why these symptoms are going to come. So what are the major symptoms? What are the major systems involved? So CVS, cardiovascular system, skeletal system, ocular system, these are involved. I have told you just in the previous box. So yes, aortic root disease is going to be there. This also I have told you. There is aneurysmal dilatation, there is aortic regurgitation which is going to be there, and aortic resection can also occur. So can you see this? This is the aorta. This is actually the aortic dissection where the blood has been like accumulated between the two layers. The blood has been accumulated between the, not the two layers, but between the layers of the blood vessels. Okay, so either aortic dissection, aortic regurgitation, aneurysmal dissection or aneurysmal dilatation, all these things can occur. Other clinical findings is mitral valve prolapse. So M for Marfan's, M for mitral valve prolapse. So this is also important and you should understand that. And of course, what happens in mitral valve prolapse? Just learn this, that there is going to be a late systolic crescendo murmur. Late systolic crescendo murmur with mid diastolic click at the apex. With the mid diastolic click at the apex. What will be the skeletal features? Of course, there will be a tall stature, long limb. Okay, so long limb means there is dolichostenomelia. There is dolichostenomelia which is going to be there. There is a joint laxity which is there. There is hypermobile joints. There is pectus deformities like pectus carinatum. This is the excavatum. Excavatum means as if something has been excavated out. So this is excavatum, whereas can you see this is something the person is carrying extra. So this is called as pectus carinatum. So pectus carinatum and pectus excavatum I have told you. There is going to be ectopia lentis. What do you mean by ectopia lentis? Ectopia lentis means there is going to be subluxation of the lens upwards and temporally. So can you see Marfan's is written like this? So can you see upwards and outwards, upwards and outwards? So the lens is going to go upwards and outwards, and yes, glaucoma can also happen. I think I have got the eyes picture. No, I have not. Okay, now in the next, you can just message me down in the comment section. I'll give you the picture. Okay. the picture of the lens. Okay, so Marfan's is going to have outward and upward, whereas a disease which is called as homocystinuria, okay, homocystinuria, that is going to have inward and downward dislocation of the lens. So how will you differentiate? I have told you, lens dislocation downward and nasal, Marfan's lens dislocation upward and temporal. Now this is a question for you all for the comment section, like which enzyme is deficient in homocystinuria. Okay, homocystinuria में कौन सा enzyme absent होता है? Diagnosis requires, what are the clinical hints? Aortic disease, Ectopia lentis, aortic disease, FBN1 mutation, aortic disease, and there is a systemic score more than 7. What is it all about? Not very important, so just remember like that. Ectopia lentis, FBN mutation in person with the aortic aneurysm, all these things. Now what is the treatment? See, these people are at high chances to develop the aortic aneurysm. That is why please understand that we can give beta blockers like propranolol, atenolol, metoprolol, which is going to reduce the aortic wall stress. We can give ACE inhibitors also, because they are also going to decrease the afterload, and since the afterload is less, the load on aorta is also going to get decreased. And of course, statins, they are responsible for doing the aortic dilatation, so these are also given. Please avoid high intensity exercises so that you don't require the aorta to work more, to supply more. And of course, aortic rupture can be prevented surgically. Yes, aortic root replacement in severe diseases can be done. This is called as thumb sign, so this is important, thumb sign. So thumb sign is seen in Marfan's because of hypermobility. And mnemonic is there. Yes, mnemonic of Marfan's, you can just remember: M for mitral valve prolapse, A for aortic dissection, R for regurgitation aortic valve. Fingers are long, that is called as arachnodactyly. Arm span is more than the height. This is important. So can you see this arm span? So generally your arms might touch this area. If you stand like this, your arms might come till hips, but their arms can even touch the knees. So the arm span is very high. I mean, the arms are very long. Let me discuss about the arm span. So for example, if you stand like this, and this is the total height. So in these, so supposedly X is the total height. This arm span is going to be like more than X in Marfan syndrome. Nasal voice, because the palate is high arch, so they will speak like hello, how are you, like that. Okay, so nasal voice, high arched palate, and of course there is sternal excavation, or in fact carinatum also, but yeah, all these things are there. So this is actually the mnemonic for Marfan's. For ectopia lenses, something okay, so the fan is above, so remember fan is up, so superior dislocation. Homocystinuria, urine is always inferiorly done, so inferior dislocation. And yeah, there is something which is called as wheel Marchesini syndrome. So we'll have to march forward, okay, like these band people are marching forward. So there is an anterior dislocation which is seen in wheel Marchesini syndrome. So this was a short little 9-10 minutes video where I have discussed all the important aspects of Marfan syndromes important for you. Thank you so much and God bless you.